Hi there, I'm Wendy McCallum, burnout and alcohol coach and wellness expert, and you're listening to Bite Size Balance, where everyday extraordinary women share their stories, expertise, and wisdom, all in the name of lifting each other up and creating a better life by design. Whether it's wellness, career, relationships, food, alcohol, mindfulness, hormones, or parenting, we talk about all things women's balance. If your life looks great on paper, but it still feels like something's missing, you're in the right place. Welcome to Bite Size Balance.
Hello there. It's me and Sarah Baillie again. We are back to talk about how to advocate for yourself in the healthcare system in midlife. Hi, Sarah.
Hi. This is a really important topic.
It is a really important topic. This was Sarah really wanted to do this topic, and I think it's a really great thing to talk about. I think it's a huge piece of the missing conversation. I think once we understand this better as women, we are more empowered and we're better able to go out there and get the support and care that we need in midlife. So I'm going to turn it over to you, Sarah. Why did you want to do this podcast?
I wanted to do it because so many women end up frustrated. So the level of frustration with the medical system in trying to support women through perimenopause and menopause is huge. I feel like, unfortunately, our medical system here in Canada is overstretched, and the practitioners don't really have enough time to look at a big picture like perimenopause, where there are so many moving parts. And also there's not a lot of answers in the conventional medical system, to be honest, for perimenopause. So it's often about just treating the symptoms. Are you not sleeping? Then here's this solution. Are you having hot flashes? Then here's this solution. And so I don't think anybody really has the time and sometimes not the knowledge.
Well, that's what I was going to say. I almost feel like the time is definitely an issue, at least here in Canada and with our healthcare system right now. Certainly where we are in Nova Scotia on the East Coast, it's a problem. But I think also there's an expertise problem in that, most, in my experience anyway, the majority of the medical doctors, the GPs that I have talked to about this, there isn't the specialized training for it in medical school. I don't know if you know more about that, but my understanding is there's not a lot. And certainly my GP, this is not an area of expertise for her. Yeah. And so she felt, I think, uncomfortable with some of the things that I was asking her for. And so I had to go seek that elsewhere. So that's probably a piece of it as well. It's just knowledge and
time to acquire knowledge. So I don't want to, it's not about putting blame on the medical system. It's being aware of the fact that you may not get all of your answers in one place. Exactly. Where you might be used to getting all of your answers about other conditions or other situations, stages in life in one place. I don't think you're going to get it. And so that's how people end up in my office. It's how they end up in, they end up listening to this podcast. They end up seeking out information for themselves. So it's perimenopausal questions and perimenopausal and menopausal symptoms are not well served in our current situation. So that's why I wanted to talk about it.
Yeah. And I wanted to talk about it. Yeah. I wanted to talk about it because I'm on the user side. So Sarah's more on the system side and I'm on the user side of this, in that I've been through this now since I'm just over a year, I guess, since starting this process, just over a year. I've been trying to advocate for myself in the healthcare system here. And I have learned a lot through that process. And so Sarah and I kind of came up with a list of a few of the pieces of knowledge that we have together, I guess, in our two very different roles in all of this. Although you're kind of a user too, and that you're in
I'm somewhat of a user.
Menopause, I'm a
user in that the thing is I know how to access all the things that I need, and I have the privilege of being able to do that.
Right.
And so I also have all the connections, right?
Yeah.
I know who the right people to go to.
And I sort of have the privilege of that because I know you. So you've been able, not that I'm using your connections, but you have.
Really?
Well, I'm not, but I'm definitely using Sarah. Let's be clear. But I'm not, I definitely am in a different position than, I guess is what I'm saying, than the average woman in perimenopause or menopause, because I'm able to access the answers from you and you can point me in the right directions. And that's been invaluable for me. And I have gotten, I feel like I've gotten a lot further faster than I would have if I didn't know you. So that's another reason why I want to share that with people, because it's not like it's a secret. It's just, we're just not talking about it. So anyway, that's the point, I think, of this podcast.
And a lot of women just don't know the questions to ask. Right. So if you're 45 or 42 or, early 40s and you are having sleep issues and period changes and headaches all of a sudden, it may not occur to you to go to your doctor and say, I think I'm in perimenopause. And it may actually not occur to them. Right. That you're in perimenopause. And so part of the figuring out is actually doing some research on your own and, sort of seeking out answers even before you go to your doctor, so that when you go in, you are as clear as you can be about the questions that you have to ask. But, just back to kind of our original point about not expecting one person to have all the answers. Often what we need to do is create this team, this sort of team effort. And, so you have a team.
Yeah, I have a team. I have a team. I mean, my team is you, my GP. So you prescribe anything in terms of, you prescribe or suggest anything in terms of supplements or
nutrition supplements,
herbal medicine, right? And then I have my GP who will prescribe over-the-counter hormonal support. So prescription,
not over the counter, but
yes. I'm sorry. Yes. Thank you. I'm so glad you're here. Yeah. I'm so glad you're here. I would totally botch this up if I was doing this myself. Prescription, but not compounded. Right. Yeah. So that means the preparation is a standard preparation, and she will prescribe a standard preparation of hormones for me, but that actually was not the right thing for me. It turned out, because it was too difficult to manipulate, and the ratio in the prepared standardized hormone preparation, for lack of a better word, was the wrong ratio for me. So I had her, she though some of what she's been able to do for me has been helpful. And then I also needed a specialist in a medical doctor who was a specialist in hormones who could prescribe the compounded hormones. And then I realized, and this is the piece that I think one of the pieces I would have missed completely. Well, I would have missed the compounded hormones if it weren't for you. I would have just been at my GP's office and just kind of been trying to work with whatever she could give me. And I don't believe this is an area of expertise for her, as I said. So I would have missed that, but I definitely would never have gone to see a pelvic floor physiotherapist for the discomfort and pain that I was having. And that has actually been really huge for me as well. So, anyway, yes, you need a team. I have a team, and Sarah has a team. Yeah.
I've got a nurse practitioner who prescribed things for me. I have pelvic floor physio as well. And I have therapy, and I have, I could have acupuncture if I wanted it.
Yeah.
So it's kind of,
should we say piecemeal. And not everybody needs a big team.
No.
Like, we're not suggesting everybody needs this huge team. We're just saying you probably need more than one person. Like, there's probably not a one-stop shop solution for you. I mean, I guess there will be for some women, but for a lot of women, you're going to need probably more than one care provider that's involved in finding the right support for you. Solution.
Just be open to the idea that or if you feel like you're not quite getting enough from the one person that you're working with, it's worthwhile to explore other options. And I'll just say that in Nova Scotia, I am not allowed to prescribe bioidentical hormones, but in other provinces in Canada, the naturopathic doctors are allowed to. So that does make the team smaller in other provinces.
Do you know, are nurse practitioners ever able to prescribe?
They don't do compounded.
Okay.
As far as I know.
Yeah.
It depends on their comfort level. So the nurse practitioner we have at our office doesn't know anything about them, is not comfortable, but
Okay.
that's okay.
So it kind of probably depends where you are and who your people are. And, but we just wanted to be clear right out of the gate that probably not a one-stop shop in terms of getting what you need.
Yeah. And along those lines too, it's not a quick fix.
Right.
So, and you have definite lived experience of that. I have lived experience of that, especially if you're in perimenopause, that is a moving target. And so I always tell my patients that we're going to do this thing now. We're going to work on this now, but this could all change.
So let's remind, maybe this is a good time to remind people, or, you know, we probably have first time listeners to this episode. And the reason why it's a moving target in perimenopause is because your hormones are not steadily declining in perimenopause until you hit full menopause, which is when it's been a year since you've had a period.
Yeah. And even then you can still have a little blip.
Right. What's happening is your hormones are kind of all over the place. It's a bit of a scrambled mess in perimenopause. And so something that works for you 1 month might not work for you the next month because things have shifted. So I think that's what you're referring to with the moving target, right?
Yeah. I mean, I generally see it more as like a sort of 3 to 4 month period. Like something might work for 3 to 4 months, and then we have to tweak it and we have to change. And, you know, so I always want women to know that not all hope is lost if it's changing, because if you look at a graph of perimenopausal hormones, you'll see that the estrogen levels are fluctuating quite wildly. Progesterone levels are generally declining. And so, in order to kind of keep up with that, sometimes we have to, take something for a few months and then maybe you're good. And then maybe you go back on it. And then 6 months later, maybe it shows up again.
Right.
And maybe something's not going to work anymore because you're closer to menopause and you need a different herb, or you need a different, so it's, it is definitely a moving target. And so we do lots of trial and error.
And I can definitely attest to it's not a quick fix, and the trial and error thing. For the first time I went to see Sarah was, I think, September of 2020. Was it? I'm guessing it was around then, maybe August of 2020. And it is now October of 2021. And I am just now feeling like I have got the right blend, for lack of a better word, of things going on. And I'm starting to really feel much more steady in terms of all of the symptoms, and just generally more like myself, which was the end goal for me. Yeah. But over the last year and a bit, it's very much been up and down. And I've tried lots of different things, and some things have worked for short periods, like Sarah was saying, and then other things have not worked at all. And some things have made it worse. Yeah. Which is important too. Like there's always the possibility when you're dealing with hormones. This is what I've learned, that because it's such a delicate balance, really, that you might be using something and it might actually cause you to go out of balance the other way. And then your symptoms are actually exacerbated and you have to cut back on that, or you have to stop that and try something different. So I've had, and if I didn't know Sarah, again, that's why I want to do this podcast, is if I didn't know Sarah, I probably would have just spun out of control with that, because I was just so exhausted from not having this stuff under control. And then it's, you finally feel like you're making some progress, and then everything just gets worse. And it's really easy to lose your mind in all of it. So I wanted to say my experience is that can be part of the process, and don't panic because if you've got your people in place to support you, they're going to be able to help you through that and tell you what you need to do. I mean, certainly with me, the maca that I was taking for a period of time, which is a natural, what do we call that? Is it an herbal supplement or just a supplement? Or
yeah, I mean, well, it's from a root.
It's a natural food supplement, I guess. Really,
I guess, more.
Anyway, I was taking a maca supplement. Yeah, it helped for a while, But then in the beginning, I took too much of it. I took the recommended dose. Do you remember this? And it really made things 1,000 times worse. And then I panicked about that and didn't know what to do. And actually another piece of my care team was the actual supplement company had a naturopathic doctor or a couple of them on staff, and you were able to make an appointment with the doctor to talk to them about the supplement and how it was working or not working for you, which I thought was a great service. They're in the States. And so I was able to talk to a naturopath about the dosing and get some really good advice around how to change it so that it might work better for me, given what I was experiencing. And that was actually very helpful. And it did work for a long time. And then it stopped working. And definitely with the bioidentical hormones, it is very much I don't want to say game, that's the wrong word, but it kind of felt like that to me in the beginning, where it's just like, let's just see what happens with this amount, you know, but you want to make sure trial and error, right? You want to be making sure you have guidance and support and all of that. But I see my specialist who prescribes the hormones, I see her every 3 months, and sooner if things are not going the right way, I will call and get an appointment to adjust that. So it took me with her probably about 6 months to find what I think is the right balance.
An invaluable part of that team that you didn't really capitalize on would have been the pharmacist who made those hormones.
Yes.
So the compounding pharmacists have a lot of information about hormones and also about all things kind of hormonal and menopause, and they're generally very, very well educated.
And not all pharmacies compound. So especially, well, I can't say especially, but here in Nova Scotia anyway, not all pharmacies compound. And so you have to find a pharmacy that compounds, and you want to find one that has a good reputation as well. So I did that through my specialist. She was able to say, I know that this one's a good one with a good reputation. And the reason that matters, Sarah, do you want to speak to that? Like, what's the risk with compounded hormones?
Well, I guess the risk is that if you have I don't want to say that if a pharmacist who isn't particularly has as much experience with compounded hormones, then maybe the standardization of trying to get that balance right might be off.
And they're not regulated, right?
It's not regulated. However, the source is all the same.
Right.
So it's just a matter of how much experience they have with actually making these hormonal preparations, and then also helping women adjust those. So, the reason why my nurse practitioner at my office, for example, feels uncomfortable with prescribing bioidentical hormones is largely because, from a conventional medical perspective, the opinion about the bioidenticals is that they're not regulated in the same way that the traditional or standard pharmaceutical ones are. And so therefore there is, with any potential for human error, there is the possibility that it's not exactly what you're looking for. Right?
Did we clearly tell people what what compounded hormones are? Maybe we should. Did you say that earlier in this podcast? I'm having a menopausal moment.
I don't think so. It's not really the topic.
No,
today,
I know, but because we're talking about this, probably people listening thinking like, what is a compounded? What's a compounded hormone versus this? What did you call it? I called it the
standard pharmaceutical
preparation.
Bioidentical. Standardized pharmaceutical bioidentical hormones, estradiol through the skin, progesterone in the form of micronized progesterone called Prometrium. I mean, that's a brand.
Yep.
Those are the standard bioidentical pharmaceutical preparations. They come in particular doses, 100 milligram tablet of Prometrium. That's a pretty typical bioidentical standardized prescription. If you are looking for compounded hormones, and you might be if you are finding those hormones too challenging to regulate, then you go to a naturopath in other provinces, or a hormone specialist in Nova Scotia, or a pharmacist, and you discuss the fact that you can have a balance of different estrogens, so estradiol and estriol, often in something called Biest, in different percentages. So some women would have a 50-50 percentage. Estriol is weaker than estradiol. So, 50-50, some would have 70-30, some would have 80-20.
I have 80-20. I had 80-20, and then I ended up, I think I moved to 50-50, and that's where I am now.
Okay. So a little bit stronger. And then you could have progesterone in a cream, or depending on what your symptoms are, oral progesterone is better for sleep. So they might prescribe the oral progesterone, the same one that is the pharmaceutical, but the compounded basically means that the pharmacist makes it up to the specifications of the prescriber. And the other benefit for compounded topical creams is that if you have a sensitivity to one of the ingredients in the preparation, not the hormone itself, but the actual preparation, and you get a rash, or your body's sensitive to it, then they can change the base of it. So
makes sense.
Okay. Clear now?
Thank you for the primer. Okay. Hopefully everyone is clear on the difference between compounded and not compounded bioidentical hormones. Okay.
Right. So that was an aside, because we're not even talking about hormones.
No, but people are listening to this podcast. We're talking about compounded hormones. They probably don't know what we're talking about.
You're right.
So,
I forget that they haven't been listening to us the whole time.
Compounded hormones is one of the reasons why you may need a team, and especially why your pharmacist might be an important part of that team if you do end up with compounded hormones. Okay.
So that was the stuff that we talked about, specific to the perimenopausal, menopausal, trying to figure it all out, what's going on and how can I make myself feel better. And then I had written down some basic advocacy notes around how to look after yourself in the healthcare system. And you may not have had to do a lot of this up to this point, but this is a really good time to start doing it.
Well, that's actually a great point. I mean, I've hardly been to a doctor in my life. I've been very lucky, knock on wood. I've been pretty healthy. And then in the last, whatever it's been, 12, 15 months, I have been somewhere every 3 weeks. So that's a really great point for a lot of women. If you've had a relatively smooth ride up until this point, it can be a drastic change when all of this stuff starts.
The first one on that list is particularly if you are feeling overwhelmed, underslept, anxious, unsure about, a little bit intimidated. If you're feeling any of these things, brain foggy, bring someone to the appointment with you, someone who can take notes, someone who can answer questions, someone who knows the reason why you went in and the questions you want to ask, so that if you blank in the office and here you might only have 10 minutes. And so you want to get your point across really clearly. So on that note, it's really important beforehand to prepare with as succinct an ask as you can. So, I'm having this, and this. I think it's this. Can we talk about that? That's kind of, you want to be as clear as possible so that you get the most out of the appointment.
Yeah. And we have said, I think on a previous podcast, that when it comes to support around hormones, it's very helpful if you also have a record of your cycles, if you're perimenopausal, so you have some information in terms of your tracking history around this, and where, you certainly would be helpful if you knew kind of where you were likely were in your cycle when you're there and that kind of thing. So if you are not already tracking your symptoms and tracking your period, Sarah recommends that you do both of those things together. So you're actually tracking where you are in your period, not the calendar date. This is something that's stuck in my brain from talking to Sarah. Don't care about whether it's, October 29th or, September 2nd. What we do care about is whether you're on day 14 of your cycle or day 32 of your cycle or whatever. So tracking the actual symptoms in connection with the timing in your cycle is what is really helpful to a care practitioner.
So, and just as a reminder, day 1 is the first day of bleeding.
Right. Thank you. Yeah.
Right. Not spotting. Day 1 is the first day of full bleeding. So keeping your symptoms tracked, and also knowing your personal history and your family history around risk factors. So in any sort of, I know most women, when they're first visiting a doctor around perimenopause, might be there for the actual sort of symptoms and let's fix this issue. But anybody who's sort of thinking about a woman's hormonal health in the bigger picture is also wondering what their risk factors are for the future, like cardiovascular disease, osteoporosis, dementia, those kinds of things, because they all fit into the same picture.
Right.
And so knowing your family history, knowing and kind of maybe if you can't remember, jotting down your own personal history. So if anything is relevant, it's there. I even just as this is not really hormonal, but I often will test women for their B12 levels and then find that their B12 is low. And then will often come back to me and say, oh yeah, my grandmother used to get B12 shots.
Right.
And so that I might not have asked that in the office, but it's all relevant. So yeah, bring someone, bring your notes, try and be clear, try and have an idea about what it is that what kind of takeaway you want from the appointment, especially if you're going to have limited time.
I always have it in my notes in my phone when I go in, like, these are the 3 things that I need the answers to, or that I need to talk to them about. And then I'll always go back and check it. And I think, it's easy in the moment to feel, and again, this isn't a reflection in any way on doctors. It's just the nature of our system is that they don't have a lot of time with patients. And it's easy to feel like you've already taken up your time and you need to go.
Yeah.
And I find having a list of the few things, and, and often my doctor will say, is there anything else? And I'll say, just a second. And I will check my list to make sure. And I've saved myself a few times from having to come back.
Yeah, absolutely.
So that can be helpful.
Often also on my list is to ask questions. So if you've been doing some research, if you've been listening to us, if you've been Googling, then you might have some ideas about what's going on. And if your doctor has different ideas about that, it's a good idea to question them respectfully and ask for an explanation as to why, because there may be a very valid reason why. And a perfect example of this is blood work for perimenopause. So a lot of women come into my office disappointed that their doctors did not test them for perimenopausal blood work. And I agree with them, because there's no point. There's not a lot of point in testing your hormones in perimenopause, because they're all over the place.
Right.
And so, but if they have not asked the question, can you tell me why you're not testing for that? Then they don't know why. And then they're mad,
right,
frustrated. Why won't my doctor care for me? What's the problem? I'm not getting the help that I need, when that's actually not the help that they need. They need a different kind of help. And so that's a perfect example of respectfully asking, can you explain to me why you don't want to test that? Or
and sometimes the answer might not make sense to you.
Yeah.
And you might actually know that there's a chance that answer is not correct.
That is true
because,
as well.
Doctors are not God. They're just mere mortals like the rest of us. And they can't possibly know all of this stuff. And as we talked about, a lot of them, admittedly will say, well, I'm not an expert in this area, but it's something I have to deal with in my practice. And so I think if you ask those follow-up questions, or you ask for an explanation in a polite and respectful way as to why they're not, they're not in agreement with you, or they're suggesting a certain treatment plan, then you can get some more information. And then that allows you to be able to make an informed decision as to whether you go seek a second opinion or you talk to somebody else. So I think all of this is important. There's nothing worse than coming out and being like, I didn't get any of the answers and I don't know why I got what I got. And then trying to figure out where to go from there.
Yeah.
Yeah,
absolutely.
Knowledge is power.
Yeah. The other thing I had on my list was keeping good records. So aside from the tracking, start asking for copies of your blood work and keeping everything together, blood work, testing, that kind of stuff. So keep everything in a folder together so that you know where it is. You can bring it to other appointments.
And make notes when you're in the appointments in the same place. So keep all of it so that you can, I learned this when my dad was ill. It's just really important to whenever you're in a doctor's appointment or an office, just to take some notes either at the time or contemporaneously. So right afterwards, that was the lawyer in me. I can't believe I pulled out that word. It's been a long time since I've used that.
I don't even know what that means.
It means very close to the time of.
Oh, contemporaneous?
Contemporaneously. So take those notes like right after, like when you go back to your car, sit in your car and just jot down some notes about what advice you were given, because it's easy to forget that at the best of times. But if you are in fact struggling with things like, fogginess and some cognitive stuff as a result of hormone shifts, trust me, this is a mistake I've made. It can be easy to forget.
Yeah.
Even easier to not be able to recall that. So yeah.
I forget what contemporaneously means.
Already you do? Menopausal moment right there. Very close to the time of the actual event, contemporaneously. Yes. I'm pretty sure that's pretty close to the definition. All right. What's your next thing?
I think that was it. I think those were the main things.
You got all of it? Okay, great.
We talked about rights. So I think we've covered pretty much.
What do you mean by rights?
What your rights are in a healthcare situation. You have a right to a second opinion. You have a right to.
No, did we talk about that?
No,
you better talk about that.
Yeah, I've lost my list. It's over there.
Hold on.
So
let me get it for you.
You have know your rights. You have a right to fully understand the treatment options. So with all the risks and benefits. So you have a right to take up that practitioner's time so that they can explain that fully. And that if they don't explain it in a way that you understand, that you have a right to ask for someone else to explain it or to come back and explain it.
Okay, that's good to know.
You have a right to a second opinion. You have a right to copies of all your medical charts. Now that sometimes involves a cost because it takes up admin time and photocopying and that sort of thing. And you also have the right to refuse treatment.
I think all of that's really helpful just to remind yourself, because it's just easy to lose confidence, especially like having just been going through this all year, like especially when it can feel like you're losing your mind in all of this. It really can. And you're not losing your mind. And a good care team is going to make sure that you're not losing your mind, but it still can happen. And I definitely have felt that way in the last year. Like this is bananas and maybe I'm losing my grip here. And is this even real? Like I've had moments where I'm like, am I making this happen? Sarah and I have talked about this. I mean, I could just cause a hot flash by thinking about the fact that I hadn't had a hot flash lately. Like it's crazy. So
that's magic.
It's not a magic power I want. I would be happy to give away that magic power. But anyway, so hopefully this has been helpful. We just thought this was an important topic to cover and something that we haven't spent a ton of time on. If you have any questions, as always, you can send us an email or a message on social media and let us know. And if you've got any topics that you'd love for us to cover, we are always happy to have suggestions on that. So that's it for today, I think. Okay, thanks everybody. We'll see you next time.
Bye.
Hi there. If today's episode has got you wondering where you are in your own hormonal journey, you'll want to download our Perimenopause Checklist now at wendymccallum.com/Peri Checklist. This free checklist is the first step to getting informed and taking back some control over your midlife. Get yours now at wendymccallum.com/Peri Checklist. That's PERICHECKLIST.